So I'm actually very pleased to be here. It was interesting driving into UCLA. I've been back here since July of last year, coming in as the LA County Health Officer at the Public Health Department. And it was very weird driving past your med school that you haven't seen in ages. And then looking around, realizing how many buildings have been put up. And then watching people walk, and then watching all the cars and the traffic and the parking, and I couldn't find where I was. So I was completely lost. Then I asked somebody, and then they told me to go to a different place. And so I got my steps in. I just wanted to say that. That's all I wanted to say. Okay? So I want to start out, I am with the County Public Health Department, but I want to ask you, how many of you know what a public health department does? All right, so give me an idea. What do public health departments do? What are they most known for?
Communicable disease outbreak.
Communicable disease outbreak, yes. Investigating those, advising on that. What else?
Health equity.
Health equity. What exactly does tobacco control? What? Immunizations. So we got more communicable. Inspect restaurants. We're still on communicable disease.
Car seats, child car seats.
Child car seats and injury prevention goes along with that.
Lead paint.
Lead paint, environmental stuff. Good. So if I had to sum up what health departments do in general, there are four things. The first is understanding the who, what, where, when, and why. And that's regarding surveillance. So one of the first things that we have to do, and most public health is data-driven. We don't just randomly come up with stuff. We're looking at things, trying to figure out where is it happening, who's it happening to, why, and then trying to figure out, well, what do we need to do? And the second thing is disease control. If we're seeing this pattern with a certain population in a certain area, what are the factors that are the risk factors or the risk exposures that are driving those numbers in terms of health outcomes? Now, it's not so good that we just understand that and we don't talk to people. So the third thing we have to do is actually communication. And communication, I would say, go to 4 Ps. The first P is the public. So having them understand, here is what's happening with health in your area, to your population, your group. And the second P is usually the press. And that's usually around communicable disease outbreaks or questions about what's happening with this issue or that issue. And that's often how we get a lot of our information directly out. But I will say that a lot of times in terms of getting stuff out to the public, we actually go door to door. We will walk the streets and neighborhoods and pass out information. Okay? Now, the third P is actually providers, especially around communicable disease aspects. Letting providers know, here's what we're seeing, here's what we'd like you to do in terms of getting information to us so that we can control this so it doesn't spread to anyone else. And then the last thing I think is one of the most important, and people don't often think of public health departments in this way, is actually resource coordination. Health departments don't have a lot of authority, to be honest with you. In terms of saying, okay, well, transportation, you need to do this, or planning, you need to do that, it's usually influence that we work through. So our role is really to try to say, what's happening to who, where, when, and why? How do we need to do, or what do we need to do in order to control that or stop that? Communicate that and then coordinate amongst whoever it is that we need to talk to in order to change that. Again, because we don't have that much authority to direct everything. Now, one of the interesting things about California, and all of the things that we actually do, actually touches upon non-communicable disease or chronic diseases as well. In addition to laboratories, having a public health lab in order to really serve the public health programs and confirm what we're looking at in terms of that data. But there's one unique thing that's in regulation that a health department is supposed to do that most people don't know. And that is work on addressing the social factors that impact health and well-being. And one of those examples is community planning. So somewhere in the legislature, folks had the wisdom to understand that a lot of what drives health is not just individual behavior, but the conditions and the risks that people are exposed to and the items or the options and conditions that they have in order to make decisions that would improve and protect their health and well-being. And so as a result of that, over the years we've had, as the leading causes of death many decades ago, were all communicable diseases. cholera, tuberculosis. What are the leading causes of death today? For some, depending on the age group, traffic crashes. Heart disease, high blood pressure leading to that, stroke, chronic lung disease. Opioids are growing. But think about that. What do we have to do for chronic diseases? There's no vaccination. We could say, go eat healthy, exercise. And this is one of the reasons I'm in public health. I said that to patients years and years out. And then I finally asked patients after I repeated that same message, okay, well, why aren't you doing this? And I had a person say to me, well, you're asking me to exercise, but I work 2 jobs, and when I get home and my neighborhood's not safe, how am I supposed to exercise? Another saying, okay, well, you need to eat healthy food. And then saying, look, I know you keep telling me this, but I don't have any healthy food in my neighborhood. It's mostly fast food places, and in order for me to get to where I need to go, I got to take 4 buses. So that means that as we think about public health, we have to understand that planning decisions are extraordinarily important in terms of improving the conditions, the opportunities, and the resources that are available to people in order to improve their health. Those planning decisions then lead to land use decisions, how things are designed, as Dick showed in terms of the pictures, and transportation is a part of those planning decisions. And transportation is extraordinarily important in terms of getting people to the goods and services that they need for their health and well-being. We often wondered sometimes how people don't show up for an extraordinarily important medical appointment. But we don't often think about how does the person get there if they don't have a car? Is there public transportation systems that will get them there? Was the community designed in a way that transportation gets them to all of those goods and services that they might need? And those decisions actually happen day in, day out, and not always do they consider health. Not always do they have that information. So one of the things we do as a health department is we actually will look at a land use or transportation decision or any other decision that may be made at a local level, like at a city level or a county level. And we'll analyze and sort of think about what is happening in that area where this project is going to happen in terms of health. Are there conditions already there that are either impacting health negatively or positively, and will this change those or add to those? And so oftentimes, some people may not know, we do what's called a health impact analysis. And here's one example of that. This was specifically around the city of LA's mobility plan, where we said, okay, well, they may not know about health, but we'll give them information about health in order to inform their decisions and make recommendations on what might be better in terms of promoting health and well-being. And it's one of the things that health departments are going to have to do better and better, not just point to other sectors and say, you're doing bad, but to say, things are not going quite the way that they should. Let me see if we can help in some way to give you information in order to make better decisions that would improve health and well-being for the long term, as well as sit with you and work with you in order to help you do that. It's not good enough for us to just point to some sector or a group and say, you're doing bad. We have to be willing to collaborate, work with, and plan with them, and bring what knowledge we have that they may not see readily available to them in terms of what they need for decisions to improve health. Now, in that, it's often very interesting to try to talk about that. Now, you can imagine as a health officer, I remember in Alameda County, I wrote numerous letters to the city of Oakland around things around housing. They were going to build something. It was going to be market rate. Well, why not make it mixed income? We already have a shortage on housing. Why make market rate when you can do lower income, a mix in that as well, and still make a profit? Or related to thinking about if you're going to put a crematorium here, it may look like that crematorium by itself won't contribute badly to the environment, but everything else in that area, and the Air Quality Management District said it's already a sensitive area. It's already got too many sources of pollution. But talking about the cumulative impact that can happen with land use and transportation decisions. And so we try to be a partner on these topics, especially with transportation, as much as possible, to try to help educate, inform, and really sit with those who make these final decisions. Thank you.